Hi, and welcome to the Health Data Ethics Podcast. I'm your host, Jenny Owens, and I'm here with another author in our series on Voices of Innovation AI Edition. Wael, do you want to introduce yourself?
Thank you. It's a pleasure being here. My name is Wael Saasouh. I'm an anesthesiologist and I'm based in Michigan. I'm also a researcher, and part of my job and my interest goes into AI and the use of medical technologies and novel therapeutics, hence the interest in the topic.
Yeah, this is fascinating. I was so delighted to see your name pop up on the author list. Can you tell me, did you have a connection into the Voices of Innovation community? How did you get hooked up with this group?
I did actually. I was invited by one of the collaborators on this book and other projects to contribute this piece, and I was more than happy to do it.
Yeah, it's such a good crew. I've learned so much
It
from
is.
from being involved in these sessions. So I read your chapter with great interest because you opened with a discussion on positive reinforcement, not only as a parenting tactic, but also as a management tool. And as someone who has both children and managed people, I thought this was really interesting. Tell me a little bit more about your thoughts on positive reinforcement.
I'm also living it as we speak. I'm the proud father of two little girls, and I'm going through the toddler years and the baby years, and there's a lot to be said there. And the basic premise of this chapter of this piece was that we want to use novel methods to reinforce good behavior, but also to identify the gems in our staff and to try to encourage them to do the things that they do well. So it's slightly different of a viewpoint than saying now we have AI, so let's just become a lot more efficient and let's start producing more because that places a lot more burden on an already almost burnt out staff.
Mm-hmm.
Um, so drawing parallels from how to deal with a toddler's emotions, for example, you want to reinforce good behavior without necessarily being too strict and too overarching. Um, and that's how we came up with the idea. And we wanted to look at ways AI could help us identify good behavior. And behavior, I don't mean you do something well, we reward you. It's look at what our staff members are doing well and encourage them to do more of it and provide more opportunities for them to develop because this is something that they would enjoy doing rather than giving them a cookie cutter job description where we say, all of you have to do the exact same things. And naturally, some people will be better at some things than others. And the reason AI would become helpful is mostly with larger enterprises and larger institutions where it's a little more difficult and challenging to identify those small trends in work behavior and to try to capitalize on the good ones. So we can leverage the analytical power of AI to identify those trends and to reinforce them.
Yeah. You mentioned the use of artificial intelligence in developing an individual or an employee. Can you talk about how you might identify a rising star and how AI might help with that?
Absolutely. One of the very fun ideas would be to gamify the achievements of staff members, no matter what kind of institution it is. We kind of draw more into the medical field just because that's what my background is.
Mm-hmm.
But being somebody who's interested in video games and who likes the concept of the game system, I believe that we can introduce something like that into the workplace where people now enjoy achieving things, not just because they have to do them because their boss told them, but because this is something I can do so much better than somebody else, and sort of introducing a healthy competitor perspective. Of course, being careful not to introduce the unhealthy competition where I have to be the top scorer, I have to be this, and this person is doing much better than me, so I'm upset with them. That's not the point. The point is to create a little bit more fun on producing results without overstressing and overburdening the staff member. So, for example, we can utilize AI to create an interface at work where there's a screen projected somewhere and shows, well, this person just achieved this, and now the other person gets encouraged. Oh, I can do that too, and I can do it better. And then maybe it can even start identifying where individual people are achieving better results in certain aspects and start combining people with similar interests and trying to put them in teams and then enhance their productivity even more. Yeah,
This leads me to my second question, right? Because you talked about how to set up organizations to foster collaboration, especially given that now so many people are working virtually, on days
right.
when they're not providing direct patient care. Tell me some more about that.
this is the concept of people working together physically is very well established. And I think with the advent of technology and after COVID and after everything that's been happening over the past at least few years, a lot of people are becoming more comfortable working individually and separately from the parent institution. And while this is very convenient for some, I don't think it fosters proper collaboration because now you and I are only a screen away from each other and we can meet wherever and whenever. And it's not the same as being in the same room with somebody and just thinking together and jotting down remarks together. And given that work from home and how our workplace has evolved over the past few years, we can still manage to put people together in the same room, virtually at least. So we can start creating virtual reality, mixed reality meeting rooms. Not even, you can create a social gathering with people from different states or different countries where people can just sit down and have a chat and enjoy something. Everybody can have their own uh, snack at home, but still be within reasonable proximity of other people. So, and I've always been a proponent of having more of a social aspect to work teams because if you can identify the human in your coworker, then you can find more ways to connect and you can find more ways to be productive naturally, not because you're being forced to. So using AI might, for example, we can create a virtual social meeting room where AI starts to change the background and the circumstances based on what they know that these individuals are interested in. And they can start providing icebreakers, opportunities to collaborate. For example, you're sitting there and then something pops up and says, by the way, this other person is also interested in A, B, or C. Would you like to talk about that? And then, think like a facilitator.
Yeah, it's interesting to think about digital analogs for the in person experience of like going to a bar and hearing like the song that you like come on and looking around the
Yeah,
room and seeing who else is kind of like shimmying. I
exactly,
love it.
exactly.
Thank you so much for taking time out to chat with me today. I really appreciate it. Before we close, is there anything you want to tell me about your chapter, about your work that I have not thought to ask you?
I think it's very important. We've been talking about AI for a long time, and the concept of AI has been around for almost 70 years or so. And the prevailing thought is that AI is going to help us be more productive. And that shouldn't be the only focus of utilizing AI or other technologies. We would like to push for AI to become helpful, but not adding burden. So just because I have AI now to analyze patient data doesn't mean that I have to see twice as many patients because I have more time for it. It means that I need to dedicate more personal time to each of my patients while delivering better results. So when we talk about AI and the use in the workforce, it shouldn't, at least I believe, it shouldn't be emphasized that this is only a productivity tool. This should be a tool that would help alleviate some of the burnout, some of the extra stress that workers and clinicians particularly are feeling, especially these days. And then we have the technologies that can help us do this, and we have the minds who are thinking that way. It's all a matter of actually putting these people together and implementing a method to help.
Well said. Couldn't say it better myself. Thank you so much for making time out to talk with me. While your chapter is in Voices of Innovation AI edition, which is going to be out in March. Everybody, if you're interested in the book, please purchase it. All the proceeds go to help cancer research, which is a wonderful thing to support. Thank you again.
Thank you for having me.